Welcome to Med Madness, your go-to podcast for mastering medical knowledge. Today we're diving into a critical topic, infective endocarditis in intravenous drug users. This condition is a significant concern in clinical practice and a high-yield topic for medical students preparing for exams. Understanding this topic is crucial, not just for acing your tests, but also for providing quality patient care in your future medical careers. In this episode, we'll cover what infective endocarditis is, its common causes and pathophysiology, symptoms and clinical presentation, diagnostic methods, management and treatment options, and a real-world case study. First, let's define infective endocarditis. Infective endocarditis, or IE, is an infection of the inner lining of the heart chambers and valves, typically caused by bacteria. It's particularly common among intravenous drug users due to the introduction of pathogens directly into the bloodstream. Common causes and risk factors include the injection of particulate matter, leading to microdamage of heart valves, increased risk in patients with HIV, and the use of non-sterile needles. The pathophysiology involves bacterial attachment to microdamaged valves, leading to the formation of vegetations. These vegetations can cause severe complications, including embolic events and valve destruction. Next, let's talk about symptoms and clinical presentation. Patients with infective endocarditis often present with a range of symptoms, which can vary depending on the affected valve and the presence of embolic events. Common symptoms include fever and chills, fatigue and malaise, cough, chest pain, and hemoptysis if septic pulmonary emboli are present. Heart murmurs may also be detected, although they may be absent in some cases. In intravenous drug users, the tricuspid valve is most commonly affected, leading to symptoms of right-sided heart failure and septic pulmonary emboli. Next, let's move on to diagnosis. Diagnosing infective endocarditis requires a combination of clinical evaluation and diagnostic tests. Key diagnostic methods include blood cultures to identify the causative organism and echocardiography, particularly transesophageal echocardiography, to visualize vegetations. Other imaging techniques like chest X-rays can detect septic pulmonary emboli. It's crucial to maintain a high index of suspicion in patients presenting with fever, heart murmurs, and a history of intravenous drug use. Now, let's discuss management and treatment. Treatment of infective endocarditis involves both medical and surgical interventions. Key aspects include high-dose intravenous antibiotics tailored to the causative organism. Common regimens include vancomycin for Staphylococcus aureus infections. Surgical management is indicated in cases of heart failure, large vegetations, or persistent bacteremia despite antibiotic therapy. Procedures may involve valve repair or replacement. Awareness and management of complications such as heart failure, embolic events, and perivalvular abscesses are also crucial. Educating patients on the importance of sterile injection techniques and considering prophylactic antibiotics for high-risk procedures are essential preventive measures. Let's look at a real-world example. A 35-year-old male with a history of intravenous heroin use presents with a 2-week history of fever, night sweats, and cough with hemoptysis. Physical examination reveals a new systolic murmur and signs of septic pulmonary emboli on chest imaging. Blood cultures grew Staphylococcus aureus, and echocardiography confirmed tricuspid valve endocarditis with vegetations. The patient was started on intravenous vancomycin. Due to persistent bacteremia and the presence of large vegetations, surgical intervention was required to replace the tricuspid valve. This case highlights the importance of early recognition and aggressive treatment to prevent severe complications. To summarize, infective endocarditis in intravenous drug users is a serious condition requiring prompt diagnosis and treatment. Key points include understanding the pathogenesis, recognizing clinical symptoms, and implementing appropriate diagnostic and management strategies. Early diagnosis and management are crucial to improving patient outcomes. For our listeners, don't forget to engage with the pre- and post-podcast quizzes and Anki flashcards to reinforce your learning. Thank you for tuning in to Med Madness. Stay curious, stay motivated, and let's change the medical education system together.